Tonight on PBS News Weekend, the death toll rises in Los Angeles as firefighters scramble to contain the flames before dangerous Santa Ana winds intensify again. Then winter illnesses return with a vengeance as cases of RSV, COVID, and the flu surge across the country.
There's a lot of sick people with coughs, fevers, sore throats, especially in the South and the West with very high levels. Soon, the entire country will be in the red.
And what scientists hope to learn from ice found 2 miles beneath Antarctica that's more than 1 million years old.
Major funding for PBS News Weekend has been provided by the ongoing support of these individuals and institutions. And friends of the NewsHour. This program was made possible by the Corporation for Public Broadcasting and by contributions to your PBS station from viewers like you. Thank you.
Good evening, I'm John Yang. There's been some progress in containing the fires ravaging the Los Angeles area. The Hearst fire is nearly 90% contained, while firefighters battling the much larger Palisades and Eaton fires are racing to contain those blazes during a lull in the winds, which are set to strengthen again later tonight. This morning, Los Angeles Fire Chief Kristen Crowley spoke to reporters.
Strong Santa Ana winds are also expected to last through Wednesday, with the strongest winds occurring on Tuesday. Every available LAFD firefighter is on hand and will remain in place through this wind event. Additionally, firefighters continue to pour into Southern California region to bolster our firefighting capabilities.
16 people are now reported to have died in the fires, with another 16 missing. Officials say those numbers will undoubtedly go higher as search and rescue teams go door to door. Aerial footage of the Palisades fire today, still only 11% contained, shows widespread devastation. Charred remains are all that are left of thousands of structures. Los Angeles County Sheriff Robert Luna says that's one reason residents aren't being allowed back into their neighborhoods to check on their homes.
In driving around some of these areas, they literally look like war zones. There are down power poles, electric wires. There are still some smoldering fires. We want to get you back into your homes, but we can't allow that until it is safe for you to do so.
Safety is also a factor in deciding when schools may reopen. The 500,000 student Los Angeles Unified School District is the second largest in the nation. All of its campuses have been closed since Thursday. Alberto Cavallo is the superintendent of the district. Mr. Cavallo, do you have any idea or any sense yet when you may be able to reopen?
Good afternoon, John. We are looking at all of the factors. Key to us is the containment of the fires, wind, speed, and direction. And the most important element is the quality of air index across the 720 square miles of our jurisdiction. Conditions have improved, but we know over the past 3-4 days, they have been dynamic and unstable. So we're buying a little bit more time, getting more information in. Meanwhile, we have inspected, assessed all 1,000 campuses. We are engaged in indoor and outdoor cleaning, removal of dust, and replacement of air conditioning filters based on need. That will all be completed by tonight to ensure we are ready to reopen. But health and the safety and protection of our workforce and students are our highest priorities.
How many of those 1,000 campuses have either been burned down or damaged?
So at this point, we had impacts to 3 schools. The 2 elementary schools that provide services to the Palisades community. We're speaking about Marquez Elementary and Palisades Elementary, have been either totally or near completely destroyed by the fires. I was on site as the fires were raging, and unfortunately, those schools will require a complete replacement. Palisades High School, a school with over 2,000 students, was partially damaged. About 30% of the campus sustained heavy fire damage, the bungalows, the athletic facilities. We're talking about close to 3,000 students impacted by the fires. But look, in addition to those schools, we have 7 schools currently in areas that are under mandatory evacuation order. We do not anticipate those schools coming online in the foreseeable future.
You've got students, staff, faculty, all displaced, many of them displaced because of these fires, the evacuations. How big a challenge does that present in getting students to school, getting staff and faculty being able to get to the schools?
You're absolutely right. Based on our assessment, and we are surveying our workforce to really determine the actual impact to our workforce, specific to individuals who lost their homes, but also those who were evacuated. We believe that that number of individuals, members of our workforce who were evacuated, is around 700 or so, maybe a little bit less as evacuation orders continue to be lifted. But that is definitely a concern. That's why constant communication is important. Deeper level of surveying of staffs is important. We've made some arrangements to provide impacted members of our workforce with free days for them to resume normalcy in their lives, recognizing the challenges they're facing. We're working with entities to provide also direct assistance in connecting them with housing opportunities. Many challenges, but considering the size of our workforce, the areas of impact have really narrowed significantly those who have been deeply impacted, but it's still a challenge.
Schools are not just places of education. You've got students who rely on them for meals. Parents rely on after-school activities for childcare. How have you been dealing with that?
So during the first 2 days of closure, Thursday and Friday, we stood up on Thursday 8 feeding centers for grab-and-go food distribution at no cost to the parents, obviously. Critically important considering that 85% of our students live at or below the poverty level, and they absolutely depend on those meals.
Superintendent Alberto Cavallo, our thoughts are with all of you out in the Los Angeles area. Thank you very much.
Thank you. I appreciate it.
In other news, there are signs of progress in talks to reach a ceasefire between Israel and Hamas. President Biden and Israeli Prime Minister Benjamin Netanyahu spoke by phone today. The White House says Mr. Biden underscored recent shifts in the region's balance of power, including a weakened Iran. The president also stressed the need for Israeli hostages to be released and for there to be a surge of humanitarian aid. Meanwhile, efforts are underway for Syria to re-engage with other nations. Foreign ministers and top diplomats from the West and Middle East met in Saudi Arabia today to map out the next steps, which could include easing Western sanctions on Syria. The summit was the first of its kind since the downfall of Bashar al-Assad's regime last month. South Korea suspended President Yoon Suk-yeol will not attend the first hearing of his impeachment trial. Yoon has been holed up in the presidential residence under protection from his bodyguards since he was impeached last month for declaring martial law. Yoon's lawyers cite safety concerns. The trial will go on even in his absence. The Constitutional Court is deciding whether to remove Yoon from office. Nobel Peace Prize winner Malala Yousafzai is urging Muslim leaders to back efforts to make gender-based discrimination a crime under international law. She spoke today at a Pakistani summit on girls' education in Muslim communities. She singled out the Taliban, which bars girls in Afghanistan from going to secondary schools.
Afghan women and girls must be free to shape their own future. The very loudest champions of their cause must be fellow Muslims, leaders such as yourselves.
The Taliban tried to kill Yousafzai when she was a teen because of her advocacy for girls' education. At the end of the summit, leaders signed a declaration outlining their commitment to empower girls through education. Still to come on PBS News Weekend, why this year's sixth season is hitting Americans hard, and what a million-year-old core of ice can tell scientists in Antarctica.
This is PBS News Weekend from the David M. Rubenstein studio at WETA in Washington, home of the PBS NewsHour, weeknights on PBS.
The Centers for Disease Control and Prevention says that nationwide, the number of people going to doctors with things like the flu, RSV, and COVID is high and surging. So what better time to check in with epidemiologist Caitlin Jetelina, who writes the popular Substack newsletter, Your Local Epidemiologist. Caitlin, is what we're seeing now sort of the standard respiratory virus season, or is there something unusual going on now?
Yeah, I mean, like you said, there's no doubt it's ugly out there, right? There's a lot of sick people with coughs, fevers, sore throats, especially in the South and the West with very high levels. Soon the entire country will be in the red. But these levels aren't unusual, right? We are actually seeing the same level of sickness that we would be seeing in pre-pandemic times. I will say, though, what is unusual is that COVID's not necessarily dominating. The main culprit right now is flu. So flu is accounting for many more emergency departments as well as hospitalizations compared to RSV and COVID, for example. And this is definitely a shift from the past 4 years.
Well, what do we know about booster shots and flu shots last fall and what effect that's having now?
Yeah, well, unfortunately, vaccination rates are suboptimal. Only 1 in 4 U.S. adults have the COVID vaccine, and less than 50% of Americans have the flu vaccine. This is far lower than our goal of 70%. I think what's even more concerning is that fewer and fewer children are getting the flu vaccines every year. And this is a trend we're seeing across all types of vaccinations. But lower flu vaccination rates, for example, means more disruptions for parents, more strained hospital systems, and more pediatric deaths. Last year was one of the worst years for flu deaths among kids in the past decade. And so there's no doubt that more vaccinations would certainly help our systems.
One other ingredient in this viral stew this season is the norovirus. Is that what's commonly called the stomach flu?
Yeah, so norovirus, think nausea, diarrhea, throwing up. It is not fun. It is also unusually high right now. We're seeing far more outbreaks than usual. We don't really know why this is the case, but typically when this happens, it means that the virus had mutated ever so slightly to infect more people. The thing with norovirus is it spread through surfaces and it's incredibly contagious and it's really hard to kill. So hand sanitizer actually doesn't work against norovirus. So you have to wash your hands for at least 20 seconds and using bleach products for surfaces will certainly do the trick as well.
There are two other viruses in the headlines, something called HMPV on the rise in China, which of course is raising unhappy comparisons with the beginning of COVID, and the bird flu. Just last week, we had the first bird flu death. How concerned should people be about those?
Yeah, HMPV, right? It's called human metapneumovirus, has made headlines in China and India, but this is not a new virus. It's been around for a while. And every year in the US, we see a flare up in late winter and early spring, and it causes less severe disease than flu or COVID. Think like the common cold, right? So while it's never fun to be sick at home, this virus really should take up very little headspace in the average American. Bird flu, you're right. We're seeing lots of headlines around that. Thankfully, we're still just seeing human cases that are directly infected from animals. We're not seeing human-to-human transmission. And the highest risk of Americans are agriculture workers working with poultry or dairy farms, as well as Americans that drink raw milk because there's high levels of H5N1 bird flu virus in those.
Is the government doing enough about the bird flu?
I mean, there certainly could be doing a lot more, especially the animal side, like USDA. We are still flying blind. For example, we do not know how many true dairy herds are out there infected. And because it is running rampant among animals, it's spilling over to humans. And the problem every time it jumps from an animal to human has the ability to mutate. And the time to prevent a pandemic is now. And there's certainly a whole lot more our government could be doing.
Caitlin Jetelina, always very helpful when we talk to you. Thank you very much.
Thanks for having me.
The graying of America is being reflected in the nation's drug crisis. Even as overdose deaths drop, millions of aging former drug users are living with long-term health challenges exacerbated by their previous substance use. Ali Rogan has our report.
A generation of addicts who grew up during the 1960s and 70s is aging. And whether they have gotten clean or are continuing to use, many are living with compromised health. More than 2 million Americans over the age of 65 have substance use disorders. That's more than a tenfold increase in a decade. And today, many are seeking support from a healthcare system grappling with the unique needs of this population for the first time. We spoke with a number of people in recovery about the health challenges they have faced while getting older, which they say are related to their years of substance abuse.
Hi, my name is Shelley Dutch, and I'm 70 years old.
I'm Mick Heidke. I'm 58 years old.
My name is Kim Hurd. I am 62 years old.
My name is Jerry Schlesinger. I'm 72 years old.
My name is Mark Knox. I'll be 62 years old this year.
I do have liver issues from alcohol abuse.
I've got hepatitis C, which was probably a direct use of my intravenous drug use.
I had issues with irregular heartbeats and arrhythmias, poor nutrition and, fatigue and digestive issues. Headaches were all part of it, nosebleeds.
Because of my drug use, I went in, I had lost 40 pounds and was malnutrition and had neuropathy in my toes. And that has gotten better.
Right now, my eyes are getting blurry, all that. My ears, I have tinnitus, arthritis, and then from the intravenous use, my leg is still messed up.
Being a recovering addict, I don't use any kind of opiates or benzos for pain. I just deal with ibuprofen and handle it.
Just being an addict in general and what I'm aware of, because I'm also a recovery coach, there's stigma.
They seem to have a whole different attitude with the addict than they do with the normal guy out there.
We're not bad people trying to get good. We're sick people trying to get well. And we as adults can go on and thrive and have beautiful lives if we take it seriously and make recovery from any kind of co-occurring disorders a real commitment in our lives.
Julie Wernow is a reporter for the Wall Street Journal, and she's the author of a recent article entitled "A Generation of Drug Addiction Survivors is Entering Old Age." Julie, thank you so much for joining us. We heard just a second ago from, among others, Shelley Dutch, who repeated a 12-step maxim, which is, we're not bad people trying to get good, we're sick people trying to get better. And I wonder, is that a perception that the people you've talked to have encountered when they try to enter the healthcare system and get medical care for issues related to their advancing age?
Yeah, the stigma attached to this generation of drug use survivors is particularly strong. They'll be, possibly going to the same hospital that they've been to 20 times before, and often are sort of treated as if, they're people who can't get better and are sort of just a drain on the system. So often what you'll see is a lot of delayed care because folks just decide, that they're not going to show up anymore to doctor's appointments or to the hospital. And when you get to be, 72 years old and used serious illicit drugs for most of your life, those problems really build up.
And so what kind of problems do people tend to have? Certainly every person is unique, but I wonder if there are any commonalities that you've come to understand in your reporting.
Yeah, I mean, this is a group just by virtue of the fact that they exist that are really survivors. One of the things that generally complicates their health is that a lot of folks, for instance, who, are using fentanyl on the street have been homeless for possibly an extended period of time or in prison. And often, those situations have, been a big wear on their health in general. You have the kinds of diseases that come about from intravenous drug use. There are folks with hepatitis C who are now dealing with, what's happened to their livers. people who've lost all their teeth. And then at the same time, you sort of lose years of your life to drug use. And so if you're starting over in your 60s or your 70s, there's a lot that you might have missed that the general population learned on the fly over the years.
Is this healthcare system equipped to help these people in the ways that they need help?
The healthcare system right now is overburdened as it is. We haven't really recovered from the pandemic. And so Medicare, for instance, is really playing catch up in terms of being able to provide the same services that you would get, on Medicaid for an older population that might just now be deciding to truly enter recovery from drug addiction.
And because a lot of those people who are entering recovery now are dealing with a landscape that was very different from when a lot of these baby boomer era folks started using, right?
That's right. I mean, when you talk to older folks who are still using or in recovery, they come from a completely different generation. And so it's interesting because sometimes you see a generational gap where people who are both in recovery, but in different generations, aren't speaking the same language about that recovery. And I've seen some of that play out as well.
So interesting. Julie Wernow with the Wall Street Journal. Thank you so much.
Thank you.
Finally tonight, scientists say they've tapped into an extraordinary archive of the Earth's climate in the ice deep beneath Antarctica. They hope it'll help them understand both how climate changed in the past and how it's changing now and how it may change in the future. At a site in eastern Antarctica known as Little Dome Sea Field Base, each of the last 4 summers has been devoted to drilling. Federico Scotto is a researcher on the project.
Working here, as you can imagine, is not easy. We work every day in extreme conditions. The warmest temperature was never higher than minus 14 or minus 16 degrees Fahrenheit.
Earlier this month, their efforts produced the results the international team of scientists had hoped for. From bedrock 1.7 miles deep, they extracted a time capsule roughly 1.2 million years old. The ice column is the length of 6 Empire State Buildings. It represents an ancient record of the Earth's climate and the story of a once warm Antarctica before it morphed into a snowy desert. Carlo Barbante coordinates the drilling project.
We will now be able to assess when the glaciation of Antarctica started. We will understand when Antarctica was completely covered by ice. There is also another important aspect. Between the ice and the soil, there is an area containing sediment and microorganisms, viruses, bacteria, that can tell us a lot about how life developed in those faraway times.
In this faraway land, the same team of 16 researchers and support personnel had previously drilled an ice core dating back about 800,000 years. That ice and the air bubbles inside it told scientists that greenhouse gas concentrations over that period, even at the warmest times, never exceeded the levels seen since the dawn of the Industrial Age.
The big picture this feeds into is climate and energy.
Climate scientist Richard Alley was recently awarded the National Medal of Science for his career studying ice sheets. He wasn't involved in this project and says this new sample is more than just a history lesson.
The models that simulate the climate as we make decisions about the energy system, we want them to be as good as possible. And by checking them against the ice core records, we can see what they do well, what we maybe need to improve a little bit, so we can make sure that the knowledge that goes to the policymakers and the public is as good as possible. It's already really good, but this will help make it better.
Now on the NewsHour Instagram account, Laura Barone Lopez breaks down what some of President-elect Trump's campaign rhetoric could mean for his supporters. All that and more is on the NewsHour Instagram account. And that is PBS News Weekend for this Sunday. on Monday, the final week of the Biden administration before President-elect Trump moves back into the White House. I'm John Yang. For all of my colleagues, thanks for joining us. Have a good week.
Major funding for PBS News Weekend has been provided by
In 1995, two friends set out to make wireless coverage accessible to all. With no long-term contracts, nationwide coverage, and 100% U.S.-based customer support. Consumer Cellular. Freedom calls.
the ongoing support of these individuals and institutions. This program was made possible by the Corporation for Public Broadcasting and by contributions to your PBS station from viewers like you. Thank you.
You're watching PBS.